So I understood that Michael traveled a lot, but he's now at the Norwich Medical School, where he has been appointed as Professor of Applied Dementia Research. And his research focuses on Alzheimer's disease and related disorders, with the idea to try to find tools to improve diagnosis, to find disease progression markers, and also to try to improve symptom management in all this group of degenerative disorders. And his work is based on a lot of different methodologies, clinical, cognition, sensor technology, neuroimaging, and genetics. And also he has been very interested in trying to find out how the different component of the papier circuitry could be involved in all these neurodegenerative disorders. So now it's a pleasure to hand over to Michael, who will talk about thalamic neurodegeneration in AD. So Michael, I think you can share your slide with us. Thank you.
Great. Thank you very much, Olivier, for the kind introduction. And great to be here to talk to you about some of our work. So I'm just sharing my screen. Great, I hope you can see all that. Great, I think, yes, so let's talk about thalamic neurodegeneration Alzheimer's disease, which is a topic really we've been dabbling in a way for many years. But of course, as we discover in Alzheimer's disease, a lot of the focus is still on the medial temporal lobe. But before we go into it, I think I just want to cover some bases, because I'm not sure how many people are familiar actually with Alzheimer's disease. And for the specialists in the audience, I apologize already that you might know all of this. But I think one of the most common points, of course, I get, just change to my laser pointer, there we go, asked is, what's the difference between dementia and Alzheimer's disease? So many people ask that always of a non-specialist audience. And the thing to remember is that dementia is the umbrella term, and Alzheimer's disease is just one type of dementia. And it's the most common form. Around 60 to 70% of people with dementia will have Alzheimer's disease, and hence most lay people would think that Alzheimer's disease is dementia. But we should just remember that Alzheimer's disease is one type of dementia, with muscular dementia, frontal dementia, and dementia with Lewy body, the others. Of course, the actual pathophysiology is much more complex than that, and you can see that here. Here you have the clinical phenotypes, the proteins, the pathology and genes, and you can see it's a very heterogeneous disease. Here's Alzheimer's disease. You can see that the proteins overlap as well, causing the pathologies and the genes interacting with that. It's really just to make clear to you that we're just talking about one type, and really that's Alzheimer's disease. Now, the other thing I need to introduce to you is the Alzheimer's disease pathophysiology progression. So it's an insidious disease, which means it's a long-term development in terms of disease. So what we usually, this is just a cartoon, so this is not real data, but it's a cartoon which most people these days believe in, is that in healthy or what's called pre-symptomatic stage, two proteins are really raising in Alzheimer's disease, one amyloid and the other one tau. And only once they raise to a certain degree, people really start changes, in particular in terms of atrophy, but also we start to see memory deficits, but it does not affect yet their everyday functioning. And hence in this kind of bracket between these dotted lines, people get the diagnosis of what's called mild cognitive impairment. So that it looks like that people will develop Alzheimer's disease, and only once their everyday functioning is affected, they will have Alzheimer's disease. Now, how these occur and which order, the order seems to be always the same, but how steep or flat these curves are depends a lot, and also what's the difference. So the indication is that these might happen up to 20 to 30 years before people develop actually Alzheimer's disease. So there is a very long latency. So that's really important to understand that we're really looking at a very long-term disease. And so these days in Alzheimer's, the motto is that, that dementia is basically a disease of middle age, but presenting at old age. So that's important to remember how it develops. Now, amyloid and tau, so the question is, where does Alzheimer's disease start? And this is a review by Michael Hornberger and colleagues in Science, where I looked at the different amyloid and tau stages throughout the brain, going from phase 1 to phase 5 for amyloid and for tau. What you can see is that amyloid is usually much more cortical distributed, while tau has the classic medial temporal lobe and then going into the cortex. Now, what you notice directly, of course, there's very little thalamic things happening, and I'll come back to that, which is really interesting. And especially the tau, I think that's actually not correct, but there we are. But the focus really has been so much on the medial temporal lobe in Alzheimer's disease over decades. And the reason for this are these findings, that the first regions where really the disease seems to start is what's called the entorhinal cortex, which is just adjacent to the hippocampus, which we see here. And what we see here is that we find these tau filaments and amyloid. The tau filaments in particular we find in this region, and it seems that the amyloid is seeding them. And then it basically moves into the hippocampus and then further out into the cortex. So this is really the classic stage, and hence for decades people have looked at medial temporal lobe, well, and are still obsessed with the medial temporal lobe in Alzheimer's disease, and the entorhinal cortex is all the rage for the last 5 years, I think, including ourselves, so I shouldn't have taken myself out of that. So where does this leave the thalamus? And really the key, what I've shown you already, that for tau in particular, which seems to be the driving force these days, is considered to be more the driving force of the disease actually. Well, Goodert and colleagues, they say, well, there is no thalamic changes. There is basically no tau happening in the thalamus. So basically I can stop here and we can go all to the next talk quite quickly. But hang on. The interesting thing is that in the old days, Brach and Brach did really the staging of amyloid and tau in the 1980s. And what they found, of course, was the classic entorhinal cortex was at stage 1 and stage 2, transentorhinal cortex and CA1, so hippocampus, were the earliest affected. But what most people ignored was that basically the anterior dorsal nucleus of the thalamus is at the same time affected. And this was already reported in 1985, but to this day has been largely ignored pretty much. And here we can see the original slides, where you can see in the anterior dorsal nucleus, there is these kind of tau filaments, which Brach and Brach reported. And John Eggleton very kindly invited me to write a review on this, which we published quite a few years back now, where we're going through all this literature and really just showing that this is happening at the same time. So that this is not only medial temporal lobe changes, which we see earliest, but that these also are changes which we see in the thalamus. And that's a really important thing, because it shows that actually this figure, as I said, which was published in Science, is actually incorrect. And that's a really, shows you that most, again, imaging studies would show not the thalamus for Alzheimer's disease. And this really leads to that people mostly look at the hippocampus and stop in Alzheimer's disease. They never look further at the whole TeS circuit. We've heard yesterday a lot on this one, John. We published last year a review article looking at this in more detail. Just to say, we looked at the TeS circuit in Alzheimer's disease over a few years, and these studies are by now quite old, but you can see basically loads of changes. Not surprisingly, hippocampus shows massive changes, but also the fornix, anterior thalamus, and cingulate. They all show changes in, for example, this is Alzheimer's disease. This is a form of frontotemporal dementia. And we published them over the years, and they were, we did also neuropathology in those cases. So I just show you the imaging, but we also did the cell counts in all those cases. And again, we could find correspondence between these kind of changes in those regions. And the thalamus in particular was always of interest, and the mammillary bodies actually, which I'm not showing here. Now, these are really crude imaging. This is whole brain imaging, so it's not very exciting, I guess, to look at what's happening. So for many years, people didn't look at the nuclei because, again, there's very few studies on the thalamus in general in Alzheimer's disease. But this changed basically 3 years ago now. This paper came out from Cambridge colleagues, who basically used for the first time the free surfer atlas. And they used the free surfer atlas in people who have Alzheimer's disease, mild cognitive impairment, or are healthy. And they showed changes in different nuclei, but I'm showing you mostly the ventral nuclei because they showed this very interesting shift there. It was a left lateralization, so there's more atrophy on the left than on the right in Alzheimer's disease, which they reported at that time. And there was different to MCI and to healthy controls. So this was, I think, one of the first studies really looking at thalamic nuclei in Alzheimer's disease. We're talking 2019, so you can see it's this really, people still, there's very, very little happening in Alzheimer's disease. And interestingly, these kind of changes somewhat correlated, well, not with the general cognition. There was just a trend basically in the memory tests, but for verbal fluency, they found more changes. But I think what this study really nicely highlighted as well are the registration challenges. And I mentioned this very briefly yesterday in the roundtable as well. What you have in Alzheimer's disease, you can have a lot of cortical atrophy and you can have a lot of ventricular changes. And this just shows you from this paper, here is a healthy control, basically the thalamic nuclei, and here you have somebody with Alzheimer's disease. What you can see, this person has quite a lot of cortical atrophy in general. The hippocampi also are atrophied, but what looks like could be like a normal pressure hydrocephalus, which we see quite often in our cases, really affects the registration quite significantly and makes it much, much harder to know actually what's happening. So this is clearly a challenge, in particular, if you have a quite small sample size to look at this, to know what's really happening. So we decided to do a study in this, and this was actually Manoj's idea, who very kindly approached me, and because he has the TeS pipeline, to say, well, why don't we use this TeS pipeline to actually look at Alzheimer's disease, and in particular different stages of Alzheimer's. And we used the TeS pipeline to basically, the TeS atlas to basically, and use their pipeline to map different nuclei onto either our controls or our AD patients. And you can see again, there is quite a difference in terms of the ventricles. And here again, you can see some hippocampal atrophy and some ventricular changes, which affect the kind of registration of those cases. And that's really a key aspect we need to be quite careful about when we look at our patients. Now, the other thing is we wanted to look at a really large sample size. So we took advantage of ADNI, actually. And ADNI is a very large network of centers in the US who basically very kindly share their data. And we wanted to look at healthy controls, which we had 125. And then we looked, for ADNI, they split the mild cognitive impairment into early versus late. And they have a quite complicated matrix, but in essence, it's really mostly based on level of education and cognitive performance, how they're split. And the reason is that the level of education should identify much earlier how people do on cognitive tasks. And then they have basically Alzheimer's disease patients as it's nearly like a patient control group. So we wanted to see how this actually changes over the disease progression. And it's always good to do a sanity check. So first of all, we looked at the hippocampus as well. Can we actually find the same changes in hippocampus? And yes, we do. So there are hippocampal changes in these cases, starting even from the early MCI cases to then Alzheimer's disease. You can see these step functions happening. We also looked at the whole thalamus. You can see similar kind of changes, even though there's quite, they're more pronounced on the left than on the right. So this kind of what Low et al. Showed as well. How about the different nuclei now? And I think the most interesting findings were that we did find some interesting changes in the anterior ventral nuclei. So we can see these kind of changes, but not for the really earliest group, but more for the later MCI groups. And also for the medial dorsal, and interestingly for the pulvinar, which I'm not sure how I still should interpret the pulvinar case changes, whether this is again a registration issue. We don't know at this stage whether the ventricle influenced this. The medial dorsal could be, of course, Alzheimer's disease patients have significant cholinergic changes, and we already just talked about this. So maybe this is affected by the cholinergic changes. So we wanted actually to find out next which of these nuclei are really related to the disease. And do these kind of changes, exactly the same picture showing you, do these thalamic nuclei changes relate to the Alzheimer pathophysiology? And the great thing with ADNI is that they have CSF data for all their cases, and therefore they have amyloid in tau. And basically what we found very interestingly, if we looked at p-tau, then it only correlated basically with the anterior ventral and the hippocampus, but none of the other nuclear changes kind of correlated with that, which makes perfect sense because that's what we would have predicted from the neuropathology again, that it's really these anterior, it should be of course more anterior dorsal, which we couldn't delineate here specifically, but it's kind of these cases, these nuclei, which are really sensitive to the pathology. But it makes it hard, of course, to interpret what these medial dorsal and the pulvinar changes, what do they relate to? Just to say that amyloid was only related to the hippocampus in that regard. And I think it just highlights again, I bring again this picture up, which is really interesting because it is fundamentally wrong. And what it should look like this, that we should actually see a lot of these changes across the thalamus for tau, because it is clear that this region is significantly affected right from the beginning in the disease, and should be much more regarded as a critical part of that. Now, this is really question now is then, so how early do these Purpose circuit changes occur in Alzheimer's? And for the hippocampus, of course, there are thousands of studies which have looked at this. And so when do these actually changes occur, at which stage? And so we just, as I said, did a review on this, where we looked actually at genetic at risk, and these are people who have a familiar form of Alzheimer's disease before they develop symptoms, and after they develop symptoms, normal Alzheimer's disease and MCI. And what you can see, most regions in this review we found already showed differences. Now, anterior thalamic nucleus here is really just, this is not actually the nucleus, but this is just the anterior thalamus. Most people didn't do any thalamic nuclei studies, as I said already before, but it just highlights that these changes happened before. And so we're doing now, we have a lot of ongoing work in these genetic cases. When do we see these earliest changes in those regions? And is there a disconnection already happening at an early stage? And the other thing, the final thing, is just to say, how do Purpose circuit changes relate to Alzheimer's symptomology? I think this is a really interesting question still, because the focus has been so much on the hippocampus and entorhinal cortex these days, but we think about it much more now as a network kind of disease. And I'm exactly like John, I think it's all about thinking about medial temporal, retroscleral or precuneus, and anterior thalamic. And if you're interested in this, I just highlight this to you that we have a very nice review, which we wrote a few years back, which looks at this, and we do a lot of more spatial tasks these days, which really produce some incredible papers actually over the last few years. And we have some very exciting data, which I don't have yet, I can't really show you yet, but that indicate that the vestibular changes in particular in the thalamus and impact on the head direction changes, even in at genetic risk people of Alzheimer's disease. So there's a really exciting work, we think, which will come up in the near future. Just the take-home messages. So I hope I can convince you that the thalamus is a key relay station in Alzheimer's pathophysiology and should not be overlooked. And despite its significant relevance, there's very little research into thalamic nuclei and how they are affected by Alzheimer's disease progression and symptomology. So it's a really open area still to explore, and many people will do, I'm sure. Our recent results show that there is a direct link between Alzheimer's progression and specific thalamic nuclei, and in particular, the anterior ventral thalamus atrophy correlated with the phospho-tau CSF biomarkers for Alzheimer's. So it's really confirming this critical role, really the pathology findings as well, how they relate to this. And there's initial suggestion that the Purpose network might be even affected in these preclinical, pre-symptomatic stages of Alzheimer's disease beyond the hippocampus. And that's really, again, how does this, it's really interesting, and how this contributes to the symptomology. That's really important. As I said, the whole focus still remains on the hippocampus and the MTL. And just, these are my funders, and a shameless plug for my book, which I wrote, which is on the science and history of Alzheimer's disease, which you can find on Amazon if you're interested in that. And thank you.
Well, thank you. Thank you very much for this very fascinating work.